and welcome to another edition of Brighton's Brightest. I'm Pam Riley, and we have here the Lukins, Mitch and Dawn, and they are the owners of Lukins Chiropractic and Massage Therapy. We are here today to find out exactly how they decided to join Brighton, the Brighton community, and we're going to find out a little bit more about them today. Welcome, you guys, and thank you so much.
Thank you. Thanks for coming.
You're welcome. So first question, tell us a little bit about your business and what you do as a team.
Sure. Do you want to start or you want me to
You
start?
go ahead.
Okay. Well, we've combined both massage and chiropractic together to help people get rid of whatever particular ailments that they come in for.
Mm-hmm.
So we've both been at this. I've been at this for 26 plus years, and Dawn has been at it over 13, 14 years. So combined over 40 years of experience.
That's amazing.
So,
you guys are great at what you do. I know my son comes to you, and I'm going to come to you. I just haven't had a back problem in a while.
That's
But,
good. That's good.
So tell me a little bit about originally where you're from and what brought you to Brighton.
Go ahead.
So we came from Grand Rapids, but I'm actually from the Detroit area, and my husband is actually from Lansing.
I grew up in a little burg called Wachusett, but since nobody knows where that is, it's the school district of Grand Ledge, which is just outside of Lansing.
I know where Grand Ledge
So,
is.
yeah.
So,
Yes.
all right, that's good. And so what made you decide to move to Brighton?
Well, we both were working independently in the Grand Rapids area. I was running a satellite clinic for another office, and after we'd been there for a couple of years, I kind of looked to my wife and said, you know, we could do this on our own. Are you ready? And she said, I don't know. Are you ready? I said, yeah, let's do it. So then we researched different areas, and it seemed like we had younger kids at the time, so it seemed like the best fit for us was Brighton, the school districts, the area. It just seemed perfect fit.
And being downtown, it must be really great for you. You have all this activity and people walking around all the time.
Yeah.
Visibility is high.
Fall's my favorite time that we get to witness all the parades.
Right from
firsthand,
here.
So you don't
That's
have to
right.
worry about it.
Because you're right on Main Street, which is perfect location. So how did you get started in the chiropractic and massage therapy business?
Well, my story was separate than hers because obviously I was already a chiropractor when I met her.
Mm-hmm.
But I was at Michigan State in the pre-medical program. I worked for a couple of years at Sparrow Hospital on the weekends while I was going to school. And I was thinking, you know, instead of going to medical school, something doesn't feel right in the medical field for me. Blood doesn't bother me, surgery doesn't bother, none of that stuff bothered me. But what bothered me was the depersonalization between who I was working on or helping as an orderly back when there was orderlies.
Right.
There's no longer orderlies. Yeah, and I thought, you know, I lost personal connection with the patients that were being cared for, and I thought there's got to be a better way. And that's when my chiropractor told me, hey, go take a trip on a campus and see what it's like. And within half a day, going through and learning their philosophy is like, this is where I'm supposed to be.
Wow.
So that's when I got into chiropractic.
Yeah, I feel like a lot of chiropractors they have that aha moment
Yeah.
where they feel like they can help in a different way that makes it's more personal, and they can, you know, individualize each person what their specific needs are.
The saying in school was, you don't choose chiropractic, chiropractic chooses you. And that's like, it kind of did.
That's
Kinda
good.
did.
The same for me with massage. I actually got into massage never to work with Mitch. People don't know that.
Right.
But I've always been open and honest about having postpartum depression, and I had it with my first son, and I didn't know how to really bond with him, so a pastor of mine recommended that I do an infant massage class with him.
I did that too with my Aiden. It was
So
great.
they recommended that for me to bond with him, and I looked forward to it every night, and it was really like a healing process for both of us and bonding.
Yeah.
So I came home one day and Mitch goes, it seems like it's going well. I mean, would you ever think about doing massage? And I'm like, I don't know. So a couple years later, I enrolled in school and really wanted to quit along the way because 400 muscles and 206 bones is a lot. I think I called him like ready to pull my hair out. Because, but the more I got into massage, the more it was like, it really did choose me. I really didn't choose it. And I think too many people today choose it for the wrong reasons and not the right reasons. And so for me, personally, it was just chosen for me, and I saw what it did for my son and myself. So I'm just very blessed to even be in it.
Oh, that's awesome.
Well, I said, when people ask me, is your wife a good massage therapist? I tell them my biased opinion is she's the best there is. But my professional opinion is she's very gifted and extremely good at what she does. And she has the very strong power of touch that heals.
And how about you? What do you feel about Mitch as a
Mitch.
chiropractor?
So what I really enjoy about Mitch and love about Mitch is his true sincerity to the profession. When you come in here, he really invests in every single patient. He doesn't want anyone else to work for him. This is what he was called to do. So he's not looking to be a big corporation. We're looking to be a family-oriented business that really focuses on the individual.
Mm-hmm.
That is, I think, what sets us apart mostly in Brighton. We've been here 13 years, so, and we work well together. So he trusts my opinion as much as I trust him. And so I think that combination of that trust is huge.
Yeah.
But also he's really one of the best chiropractors that I know. I mean, my children have been adjusted since they've been infants. They're now 17 and 20.
And they're good looking and they're
good
really
looking.
healthy. and-
Chiropractic has everything to do with
Yeah.
right, that's just you guys.
So, and his commitment to the profession, I mean, he will help anybody in need, even if they can't afford it, and I appreciate that about him. It's truly a gift that he just really loves what he does, and if he can give it to anybody to give them hope or prevent surgery, or if you can, you know.
Get them off medications.
Yeah, I mean, I've been
Oh, yeah.
adjusted by a lot of chiropractors in the profession through the years just to see.
Mm-hmm.
And one thing I love about Mitch is he's very gentle, and not a lot of people are like that. I've had adjustments where my neck was overly twisted and I didn't feel so
That
good.
big neck twist is scary.
Yes.
Yeah.
So as much as he says I have a gift, he really has a gift, and this was just his calling. So I think it just glides in smoothly. Maybe it's just the energy of it. I don't know. I can't explain it, but that's probably one of the things. And I trust him wholeheartedly. He's very smart, which actually gets on my nerves sometimes, but it's okay.
That's good.
I deal with it.
So, do you guys refer clients to each other? I mean, it goes hand in hand, right? The chiropractic and massage.
Ideally, it does.
Mm-hmm.
But we do not pressure one way or the other. You should have an adjustment. You should have a massage. We might suggest, hey, this might be a good avenue, a good supplement to what I'm doing, trying to help you with your problems here. But that might just get us over the edge to where you feel fantastic. There's no pressure in this office.
I know. I mean, when Sheldon comes in, we don't, you just treat him for his massage, but you never suggest chiropractic, which maybe we should think about. I don't know yet because he's gotten beat up over the year, but
Yeah.
you guys never pressure that. So I mean,
No.
it's definitely a nice combination.
We both agree that yes, we're involved in taking care of you, but you as the patient or client, as the case may be, also have to be involved in what you want to get out of the care that we're going to be providing for you.
If you come in and you just assume something's not going to work or you're totally against it, it's not going to work.
Yes.
Right.
This is not the profession for you.
Mm-hmm.
So in Sheldon's case, your son, he could use probably chiropractic, but when he comes in, we listen to our patients. What are you looking for?
What are you looking
so
for?
when they tell me I'm looking for a massage for my son because he had a concussion or his neck was injured, then we're going to go that route while at the same time giving you the knowledge of the benefits of both. So if you choose to do that, then that's on you. We don't pressure that in any way.
Right.
So I
Which
just
is
think,
nice. So what was it like when you first started here in Brighton? Was it difficult to find clients, or were people open to, going to a chiropractor or massage therapist? What was it like when you started?
Well, when we first started, we bought an existing practice that the chiropractor was retiring and moving out of state, and he was kind of, so he had a base of people that came to see him in his office, and he had a massage therapist, a couple of them, I believe, but he was looking for somebody who was the right fit for his people. So he actually turned down a couple of chiropractors who wanted to buy his practice, and decided not. So we had a little bit of a start of a base. And then after that, all it took was her personality.
Aww, and we love your personality.
I think it's like I went into the schools, I really integrated myself in the community. I kind of took anything anybody gave me. So like if they invited me to a ladies' night out or to lunch or We joined the chamber for a little bit. I know Mitch did.
So what are some of the things that most people don't know about your business? They might not know that it's a combination massage.
I think chiropractic is hard. Mostly that is the foundation of our office, is chiropractic. Because without the spine is like the engine of your car, and without that, you have nothing else. I'm the secondary aspect. So many people focus on the massage because it feels better, but that's not long-term well-being.
Mm-hmm.
Long-term well-being is going to be the chiropractic, just keeping your spine in alignment just for over everyday health.
Mm-hmm.
People come in once a week or once a month for maintenance. I mean, we give them the options of what their body knows what they need.
In the past, and this has been changing probably in the last 20 years, is that the medical model seems to dominate the healthcare field. Well, my doctor says I shouldn't do this. My doctor says I shouldn't do that. I need to take this. I need to take that. There's been more people seeing chiropractors. As a matter of fact, we have more office visits now than any other healthcare provider as a profession. So it's becoming more and more mainstream than it used to be. But the big misconception is that people don't understand what it is that we actually do. They think we're back doctors. We're not back doctors. We're actually nervous system doctors. It just happens to be the nervous system, the central nervous system, your brain and your spinal cord is located in your back. And the brain and the spinal cord are master computer, right? You can't jumpstart your brain and spinal cord. You can jumpstart your heart, but you can't the brain.
Right.
And it's so important to the body that it's completely protected by bone. Skull for the brain, and the spine protects the spinal cord. So the communication between the master computer and the rest of your body takes place where the nerves come out from the spinal cord, and that happens to be where the spine is misaligned. So where the spine is. And so when there's any irritation of any nerve in your body, whether you feel it or not, wherever that nerve goes to can be affected. For example, stomach issues, intestinal issues, numbness in the leg, muscle weakness, all that kind of stuff could be related back to the spinal. Not always, but that's always a possibility of looking into.
Depression and anxiety have been linked to issues with the spine.
No kidding.
Sure.
Never knew that.
Sure.
I went through my own.
Since I've been at this for 26 years, you kind of see this for a long period. If somebody's in a car accident years and years ago, and they're in chronic pain, and they're always in pain because that vertebrae was never fixed, or that, whatever it was never put back where it belongs so the body can function properly, pain over a long period of time, chronic pain and things like that, lead to depression. Because if you're in pain all the time, eventually it's going to get to you.
Because your quality of life decreases.
Yes.
You don't do as many things because you're always in
Less
pain.
active and all that stuff. So.
But I also wanted to mention that Blue Cross Blue Shield of Michigan did a study,
Mesa,
I'm sorry, of chiropractic on some of our patients that are 10 years, that have been with us 10 to 12 years. That's the other thing. We haven't really marketed a whole lot because we've had such loyalty for the last 13 years. I think our retention rate's about 90%.
Wow.
Yeah.
And
That's
so
incredible.
I'm just really proud of that because I work hard on each person. So I've known these people for so many years.
Yeah.
But also when Mesa did their study, it showed their overall healthcare costs went down 30%. 7%, I'm sorry, by including
chiropractic care and massage.
massage.
And that's what people's like, well, it saved people money? No, it saved the insurance company money. So the insurance company sent out a flyer to all of their members saying, hey, look, you have this coverage. It will save us money if you utilize it.
And so go use it.
And they pay
So
us the
it's-
least amount of any profession out there.
Yes, we don't
We
get,
are
it's
paid
not,
the least.
we don't get paid a lot.
So, yeah.
But with Mesa saying that, that basically says, take care of yourself this way. That way you don't have to take all these medications. You don't have to get the high cost surgeries. You don't have to have the, disabilities and all these things. And a lot of chiropractors are offended by somebody saying the term crack. Who can crack my back
Crack
or
my
whatever.
back, right.
That doesn't bother me. It makes that type of noise. I don't care about that. The noise is actually called cavitation, which is the release of gases in the joint capsule that makes a popping noise. It's no big deal. Doesn't mean anything one way or the other. But what really irritates me is when somebody says, well, I usually have my wife crack my back, or I usually have my mom crack my back, or whatever.
Or
my kids
walk
walk
on my
on
back.
my
Or walk on my back. Yes, that
We've had people
irritates
have-
me because people have been severely injured because of doing something they don't know. Your spinal cord is there. Without it, you don't exist.
Right.
Don't mess with what you,
You
don't
can
know.
do without a muscle.
Right?
You can't do without your spine.
Right.
That's why it's so imperative. They're very different. And
Mm.
so people ask me if I could only afford one or the other, which one is more important? Well, the chiropractic. I mean, I'm not degrading what I do in any way. But without the spine in alignment and the proper nerve system working correctly, the muscle memory for the massage is not going to work where they want it to go. And so, yeah, but we've had people with punctured lungs, husbands and wives in ERs because the husband tried to adjust the wife's neck. I mean, it's been absolutely, I just can't believe some of the things people do.
Oh, that's scary.
Yeah.
You know, I have a friend that asked me to walk on his back, and I'm like, you know, I weigh a lot more than you think I do. I'm not stepping on your back. And men think they can handle it. I'm like,
It's
no.
a very rare chance, but why would you take it at your spine?
Right.
I mean, I'm sorry.
Won't
but-
do it.
When I was a freshman in high school, our senior goaltender was about close to 200 pounds. Big guy, really big guy. And he had a little 90-pound girlfriend. And he would have her walk on her back, on his back, excuse me. And she injured him one time so bad he was out the rest of the season. Not knowing what you're doing with the spine, don't touch.
Don't
Yeah.
touch. Don't touch. Okay.
Yes.
Good. All right. So let's talk about a little bit about the future. Do you guys have some specific goals for the next year or 2 or 5 that you really want to lay out, or
I have a goal.
Yeah.
And my goal is that I want everyone to know about him. Because the reason is he's a great doctor. And I don't think the community gets to really see that because we didn't come, and I'm not degrading anyone in any way, but we really built this from the ground up. We had 0 going in. So when you don't have the financial huge investments from whomever, you don't have that notoriety and that, you know, you're not all over the community. And so chiropractors are very popular because there's so many, right? And so you can get lost in that. And I just wish people would see what a great doctor he is. He's very smart. He has a certification in nutrition. So he also knows how to tell you what works for you if you have issues like heartburn issues or whatever issues. I always go to him like, well, I'm this today. And I'm like, okay, well, you take this. And so he's very educated in that as well. So it's not just the chiropractic, it's like what works for my body.
That's great.
But I only do those particular things if that's what the patient wants.
Yes.
Right. If
I
they
don't
ask.
They
force,
ask us.
you do not have to have nutritional consultation when you come to our
Yes.
office. It's not necessary.
But it's,
It's
a
just-
bonus.
It's
Yes,
here if
there's-
you want it.
There's pretty much
Right.
anything that you can ask him that he'll probably know.
Right.
Like my kids are.
And if I
like-
don't know it, I look it up.
Yes.
Because I don't know everything.
Well, I had a polio patient come in probably 12 years ago.
Oh.
She's 63 years old, had polio since the age of 2. And one thing that I'm really proud of, I've worked on her for 13 years, and her polio has not advanced in any way. So we've been able to maintain where she is, which is huge. So she can continue to live a quality of life where she can still enjoy her life.
Wow.
And so that is really, I'm really proud of
That's
that. But I didn't know how to work on her at first.
And she's one of the sweetest
So,
people on the
yes.
planet.
And so I told her, can you give me 2 weeks and let me research this and call my mentors and call my instructors and really figure out what's the best care plan for you. And she was so grateful for that because I was honest with her. I'm just not really sure. We studied it a little bit, but I didn't feel confident. And if I didn't feel confident in it, I didn't really want to do it.
Right.
So once I got the 2 weeks in, my instructor spoke with me. I had a great support team, and they said, Dawn, you can do this. And so we had a care plan set out, and it's been 12 or 13 years, and
Wow.
she's done really, really well. And so I put a lot of work into that, so I was
That's
just
amazing.
grateful that she's still doing that. So
That's really great. I mean, that really means that you take that individual and you really research the specific person and their needs. And
yeah, because if I don't know, I'll just be honest and say, when you come here, you're not getting the same massage every time.
Right.
Because it's like, what's going on today?
Specific.
Everybody I always ask them, what could I improve in my office? Or what do I do different from somebody else? And so they always say, will you listen to us? And I think so many people don't listen. And if you go to other offices, the massage therapists are way at one end of the building and the chiropractors at this end, and they don't really communicate.
Right.
Well, in here, we always do, if it's a new person, we consult together.
Mhm.
And even if they're not getting chiropractic, I always use his wisdom. Why would I not?
Right.
It's somebody's body and it's a person.
Right.
And I have that advantage of being able to have that extra wisdom and education.
And a go-to.
Right. Which makes me different than a lot of therapists because I have 22 years invested in chiropractic.
Right.
So you got 22 years in chiropractic and 15 in massage almost, and it's a big, huge, thing.
That's amazing. That's great.
Even if somebody's on a care plan, if they come in more frequently, every time they walk in the door, their body can be completely different because everybody's body is constantly changing, trying to
Day by day.
Stress.
trying to compensate for environmental factors, everything, work, environment, everything. So the body, they come in with the same pain, but it's a different vertebrae that needs to be moved.
The difference between men and women, though, I just want to say that because of that. Men come in when they're in pain. Pain is the motivator for men. It's not, I hope no one gets offended. I'm not trying to say men and women. I'm just saying pain is a motivator for men. For women, their first diagnosis when they come in, because we all diagnose ourselves, is I think I have cancer. Like everything goes to that. Everything. Like, and it's like, well, we don't know that. Like, let's just see what's going on. And so it's really trying to assure them that, well, let's not go that route first.
Yeah, let's
just
not
see
think
what's
of the
going
worst
on.
case
Right.
scenario.
But the other thing that's really imperative with therapy that I found through the years with massage therapy, whether you come here or not, it's okay. But if you go into a therapist and make sure they're licensed in the state, make sure that it's safe, make sure that it's you feel comfortable, because if you don't feel those things right away, it might not be a good fit for you.
Mm-hmm.
But also the education is important. If you got a therapist doing the same massage over and over and over, that's not really going to help you.
Mm-hmm.
I mean, it might feel good, but it's a waste of money, it's a waste of time, and you're not really moving in
Or benefiting.
And that's a therapeutic
Yes.
aspect. You need
Yes.
somebody who, the deep tissue is great for some people, not so good for others. I mean, it has any care plan that we do, you have to organize it for each individual patient.
Mhm.
And everybody's different.
Yeah.
There's no two people exactly
Yeah, I
alike.
never treat anybody the same.
No.
So even people that have saw me for 13 years say, every massage is so different, because I just don't do the same. It's like whatever I'm feeling that day, I think when you've been doing this a long time, there's that intuition that goes into it. So it's kind of like I just go into what I'm feeling or maybe what they tell me. And so every time is different. It should be, you know.
Yes.
Now, you want my theory on the difference between men and women?
Yes.
I developed a theory. There's always exceptions to theories. It's just
I
a
can't
theory.
wait.
My second year in practice, I was out of school so I'd seen quite a few people by then. And my theory on men and women. Women will do the preventative care. They will do the dental appointments. They will do the checkups, yearly checkups. They will do all the stuff for prevention. And men will only go see somebody when their issue prevents them from doing something that they like. Not work.
Golf.
Golf. Golf, bowling, and chewing their food.
Yes.
If they're toothers so they can't chew their food, you'll be done right. They'll be in the dentist the next day. So my theory, the basic theory, my hypothesis is that men get married to keep their teeth.
Because the women are going to make the
Because the women will make,
And they're going to make you go.
Exactly.
It's funny. And then they'll feel better if they make the chiropractic appointments
That's right.
and the massage appointments.
My favorite is the husbands that are forced in here.
Oh.
Because their wives are like,
Yeah.
I'm so tired of you being mean. I can't massage you anymore. Like, I don't know what I'm doing.
Yes.
So the husbands are begrudgingly walking in. Like,
My wife made me do
Well,
And that's another thing too, is the spouse or significant other or whomever it may be, the kids or whatever it is, when you're in pain and you're at home, your attitude changes, you're not as nice. I mean, it's just a fact. We are not nice.
we see the
So
best
I've
of
had wives and I've had husbands saying, I made her come in today or I made him come in today because I can't take him at home anymore. I can't take her at home anymore. She's just terrible, mean and whatever. So yeah, it's a
So
big
they're
deal.
in like a Christmas buying. Can I
Big
get
deal.
enough gift certificates for the year? Because I figure if she can come in like 15 times, then I'm good. You know?
She'll be nice
It sounds
to
like
me.
you really want 15? Yes.
That's so
I will
fun.
Whatever it
pay
takes.
Whatever it takes.
Good idea for the holidays.
Yes.
That's right.
All right, well, tell us a little bit about your family.
Oh no.
I mean, I think it's
We don't
important.
like each other.
You're a super awesome Brighton family,
We like
and you know
that.
you've got athletic kids, and so
Yeah,
go
we
ahead and
have-
tell
we
me
have
a
two
little bit
boys.
about your boys. Yeah.
We have two boys, Alex, he's 20, and Ethan, who is a junior this year, and he's on the basketball team with your son, Aiden.
Yes.
Yeah. And
And he played football.
yeah, he did. He
Then they
did.
went undefeated.
Yes.
Freshman,
That's right.
JV season.
Freshman JV, undefeated. Chiropractic is more than just treating pain, all right? And actually, chiropractic was founded on a deaf man being able to hear again.
Is that right?
That's absolutely right. There's an anatomist in Davenport, Iowa that had immigrated from Canada, and he was doing his studies. Well, one of the janitors in his building had lost his hearing when he was a little bit old, probably, I don't know, as a kid, but so he had normal hearing as a kid. So Dr. Palmer is asked to take a look at him and found a vertebrae out of alignment in his spine, put it back in within a day or so he could hear again.
Are you kidding?
That's how chiropractic started, 1895.
Wow.
It did not start with back pain, did not start with headaches, did not start with migraines. It started on, we happen to help with it. It was hearing loss, which a lot of people can't quite understand why that is.
How that's connected.
Yeah, so over the years, I think probably the most satisfying and interesting case that I have done personally is I saw this woman back in another office in Taylor. I was seeing this woman, she would come in every Tuesday like clockwork, and she had a little girl about 18 months old. And she came into my office one day and says, "I can't see you next week, I have to cancel." I said, "Why, what's going on?" "Well, my daughter has to have surgery." I went, "Surgery?" And I went, "How? I mean, she's 18 months old. What could possibly be wrong with her?" Well, it turned out they wanted to put tubes in her ears. So I told her, I said, "Why don't you do this? Don't cancel the surgery." I said, "Just postpone it for a couple of months. Bring your daughter in with you and let me just work on her a little bit. And then if she still has the ear infections that won't go away, whatever, and the tubes are necessary, then by all means, get it done." So she started bringing her. Within a month, the ear infections disappeared, and she went in to see her surgeon, and he said, "Well, her ears are clear," and she told the surgeon that she'd been coming to a chiropractor, and he got mad at her for canceling the surgery.
Of course he did.
And I was thinking, why? Your patient
That
is better.
healed,
So
right.
basically, that comes down to the body knows how to heal itself. Just sometimes there's an interference with the body's master computer
Yep.
and going to those cells that need that information to heal properly.
Yes.
And that's where chiropractic comes in.
Wow.
It's
And
not just pain.
Right, and massage, kind of going off of that, is people think it's like this feel-good thing, right? It's actually creating micro tears as if you worked out for 45 minutes for an hour. So I'm actually creating injury into the muscles to tell the brain that something's wrong, and it brings in blood flow and healing.
Oh.
So when there is a stagnant spot in your body, meaning like a knot, like a lot of women have shoulder,
We call it a trigger point.
yeah, a trigger point. But when there's a spot in there that is like knotted up, the blood flow can't go in that area. So then it just forms and forms and
Stays
forms.
And
And
it
so-
never heals.
Right. So creating the therapeutic work or the massage work and getting into the muscle actually creates the tears to tell the brain something's wrong. So really, Mitch and I really don't heal the body heals itself. We just
Correct.
give it that little push.
Oh, that's awesome.
So it's pretty cool to
We are what we call facilitators.
facilitators. So
That's
we
amazing.
don't really do anything
Right.
as much as we think we do.
Yes, you do though.
Yeah, I call
Being
it-
the facilitator
Well,
is the
you got to know how to push the body in the right direction
Yes.
for the body to take over and heal itself.
Right.
That's what we do.
So, yeah, so massage is very similar. It's not just massage. A lot of people think you can't hurt people with massage. You can if you don't know what you're doing.
Right.
You got to know the difference between a lipoma, a knot. Could it be cancer? You don't want to spread anything. You could hit a knot in the body and actually spread cancer.
Oh my gosh.
So you do have.
It's
to-
rare.
It's very rare. But you have to be but you have to be educated.
Thanks for the disclaimer on that, because I'm like, oh no.
But you have to be educated into the difference. A person's intake form is thoroughly done. Their family history is thoroughly done. So and then intuition becomes a factor too. What am I feeling in here? So, and I had a lady that I was working on for a year and could not get her better. And for a therapist, it's frustrating. For the patient, it's frustrating, or the client. And so I didn't know what to do. And I just told her, I just feel like something's wrong. And so I recommend an MRI or an X-ray. Do you know she went for it? She's 70 years old, and her leg was broken. She went in for surgery, and they never fixed it right, so it was still broken and it healed wrong.
No.
So she's 70, and she had to have another break, another surgery.
No.
And yeah, so you just got to be educated into saying, I'm not really sure about that. So I think that's the difference with me.
And that's where the experience comes in for us.
Yeah.
We can spot those red flags.
Yeah.
Right, and you call them out. And
Right.
that's
And
Oh
I
yeah,
found-
absolutely. Send them to the right person who's in the right area, what their expertise is to deal with the
And
specific
I had a lady
issues.
come in and I didn't feel right about a mole because we're trained in that. Like people don't look at their backs. And I'm like, I really recommend a dermatologist. Here's one I recommend in town. So that's the other thing, we're referring to each other. But it was cancer. So she thanked me for saving her life.
Wow.
So, I mean, you don't know. So there is a lot more that goes into it than just doing massage.
You know, and a lot of people think it's just a feel-good thing,
Yes.
the massage part. Oh, I'm just gonna get a
Like
back rub.
Yeah.
And it's way more than that.
Well, it's more than that for us.
For us,
We
yeah,
look
in our
at it very
environment,
differently.
because we want
But I'm not-
to attack specific issues and
Yeah.
fix them for somebody.
I don't really care how you feel here, not to be mean. I care about in your life. Can you play with your grandkids? Can you enjoy your life? Can you go on vacation?
Yeah.
Can you clean your house? Can you do things?
Yeah.
Like, you're only here for an hour.
Could
So-
you improve your time at your track meet?
Yes.
Right?
Oh, we did that too.
We did, yes.
We helped a
Yes,
boy, yeah.
we've had one of the students, younger one, he's not an upperclassman, he's one of the younger ones here. He was a distance runner, and after, I believe he had, not shin splints, plantar fasciitis.
Oh.
And we mostly worked on it, and I gave suggestions with stretches and things like that. And he improved his time in 1 or 2 visits for, I believe it's the 2 mile, whatever distance runner they do in track, 10 seconds.
Wow.
And his coach said
Came
that
to us.
his
And
coach,
then he's like, can I bring the whole team?
well, his coach said that I've never seen anybody that has plantar fasciitis come back a couple weeks into the season and actually finish the season without plantar fasciitis.
Wow.
So yeah,
What
that's
a
cool
rewarding,
things like that.
what a rewarding job, you
Well, that's why
know?
we
Absolutely.
do what we do. It's never been like to be anything other than how can we best serve people. And unfortunately that, you know, there's pros and cons to that, but that is our main soul of who we are, is we just really want to help people.
Yeah.
And I really mean that. I mean, like I said, it's not all about the money. We work out anything with people. We do the best we can because we love what we do, but we want to see people healthy and happy.
Yes.
Just like I want to be healthy and happy. So
Let us know how we can contact you if we're interested in getting your services.
Easiest way is phone or text our number, and it's a simple number. It's 810-220-4040.
Easy.
220-4040. That's the best way to do
220-4040.
it. You can text that number or call that number. That's my cell phone, but it's also our office number, so it's always me that you're going to get a hold of. As long as if somebody wants to respond, if I can't respond, if I'm busy, which I tend to be from time to time,
Yeah.
that please identify who you are and why you're calling, so I'll call you back. If not, I might think you're a telemarketer.
Yeah, right. We all have that problem.
And then also, besides the 810-220-4040, we are on Facebook, and you can look up Lukins Family Chiropractic on Facebook. You can Google Lukins Family Chiropractic or Lukins Chiropractic, and we should be up. They're easy to find and easy to see.
You are easy to find. I have Googled.
Downtown's real easy to get to.
Right. Yeah. Tell us about your location and where you are in downtown Brighton.
Sure. We're at 533 West Main Street. And if anybody knows downtown Brighton, we are just past all the restaurants, going away from Grand River, just over the railroad tracks.
Towards the high school. So
Kitty corner from Brewery Becker. Yeah.
kitty corner from Brewery Becker.
That's right.
A lot of people know that place.
Yes.
Yeah,
you can stumble on over.
Well, now I can also choose
I'm
not
kidding.
to treat people if they're inebriated.
No alcohol involved
Yeah.
when you get your chiropractic.
Especially with massage.
Yeah.
Exactly.
Yes.
Right?
Yes.
Well, thank you so much for
Yeah,
joining
thank
us
you,
today.
Pam. Appreciate it.
Yeah, and I'd like you all to tune in again to Brighton's Brightest and look us up on parkbench.com/Brighton-MI, and you can see more interviews from more owners of businesses and important people in the community. So thank you for joining us and have a great day.
Thank you.
Thanks.
You.